Welcome back to the Mindful Professional, local impact series where we shine the light on professionals who are making such a beautiful, great impact here in our community. Today, I'm thrilled to welcome not just one, but two incredible guests, Dr. Tracy McNeil and Dr. Jefferson McNeil, co-owners at Simpatico Physical Therapy here in Sterling, Virginia. Together, they've built more than just a clinic. They've created a space where patients truly feel that they're being seen, heard, and cared for. Whether it is helping somebody recover or helping avoid chronic illness or just find joy in movement, Tracy and Jefferson, they bring their expertise, empathy, and presence to everything they do. We'll explore their personal journeys, their approach to mindful patient care, and the ways they're leading with compassion in the community. And along the way, you'll hear some practical tips you can use in your own lives to bring more mindfulness to your health. Tracy, Jefferson, welcome to the show. Thank you so much for taking the time to join me. I know you guys are busy with managing the practice and seeing patients, so I'm so thankful that you've taken some time. Again, I have Dr. Tracy McNeil and Dr. Jefferson McNeil joining us today. So I want to start with the beginning. Tell me what got you into physical therapy. How did all of this start? How does your journey start?
Thank you for having us on, first of all. I don't think our stories are exactly the same. So I'll just give you a quick intro to what brought me into physical therapy. I had no idea what it was, and I understood science and I had a background, but I was I didn't have direction in what I really wanted to do, even going through school, through college, but I did know what my interests were, and I was interested, although I didn't have a name for it, but I was interested in biomechanics and how we move and that sort of thing. I've been a lifelong runner, and when I would go running, I would run in the woods and on my own. I'm rather extroverted personality, but that was my little introverted time where I could think.
Yeah.
And I thought about a lot of strange things when I was out there, like how is my knee moving, or what's my ankle doing, or how do I react to the ground or to that rock or whatever it may be. And so I didn't really have a name for that or know what that was, but I had that interest.
Right.
And luckily, I stumbled upon biomechanics and kinesiology, and that's what brought me into physical therapy. It was perfect because physical therapy, the study of movement and function, was what my interest already was. So I had that title then.
Very interesting, because not all of us think about, how am I moving and, how am I reacting to when my feet touches the floor, things like that. So very interesting, very intuitive. What about you, Tracy?
So it's really interesting too, because I didn't know anything about physical therapy either. But my entire childhood, my family has been pushing me into medicine, like be a doctor and do this. But I didn't really want to be, I didn't want to do anything that I would be on call for.
Yeah.
So, but I kind of stumbled into physical therapy while I was doing volunteer work at the hospital as a high school student. So somebody that worked for a physical therapy practice, their receptionist actually said, "Hey, we're looking for student aides. Would you be interested?" And so I said, "Well, that sounds pretty cool." So I went and so one of my first jobs is a tech in a physical therapy practice. And so it just actually brought a whole new world of medicine for me, where it was so much more easygoing, and it was fantastic because you could see people go from not being able to do something to really just returning to normal movement. So I applied for PT school, but I don't think it was until I actually started doing my clinical rotations that I really fell in love with the actual job, like the occupation.
Yeah.
And, I am not the type of typical physical therapy mind that you would think, because I'm not a big fan of exercise. We are totally opposites in that manner. But I love the teaching component of physical therapy. To me, it was either teaching math or physical therapy. And so I feel like it kind of brought a lot of the things that I actually like into it. And I like the fact that I get to see my patient, multiple times, get to know them, their goals. And then I think just being a therapist has added years to my life because of what I know,
Yeah, makes sense. And in many ways, I'm like you, where my family always wanted me to be in the medical field, but I was like, I really don't want to work 36 hours straight. And when I found audiology, I was like, this is it. So I relate to that part. So you said you would have been somebody who would be teaching physical therapy. So how did you end up choosing being in private practice over teaching at a university?
Well, I think private practice is really the only way we can practice physical therapy the way we want to practice it. Teaching to me is great, but I really truly love patient care. I think that if I didn't get to do it, I don't know if I would stay in the field. I think that's really why, and again, that's why we opened the practice. It's because we were, the different settings that we have been in, you end up managing, other people managing your patients for you versus you being the person that does it.
Yeah.
And so this is really the where our love for therapy, is. So
I think teaching methodology is, we tried other ways. When we went through our formal education, I don't know, medicine probably is similar, but we are taught in templates and algorithms and if-thens and that kind of thing. And you have to learn that. You have to pass your board exams. You go through your clinical instruction and people are asking you questions and you have to come up with the answer. But then once we got into the practice, I felt like, and I think one of the things I saw in Tracy was I could sense her frustration too, because sort of the standard way of reactive medicine is to do to the client. It's a passive form. It's doing something to the client. And we worked in that setting and we did our best in that setting, but we felt that that wasn't the optimal way to deliver care. And we came on this journey where we felt the optimal way to deliver care effectively, long term too, was to teach people how to take care of themselves. Right. And we didn't feel that standard model provided that. We felt there were too many barriers to that. And
specifically.
And so that's where we decided, well, if we're going to do this, we're going to have to do it differently. And we're going to have to do it ourselves and open our own practice, because, of course, sort of the standard of care does not, medicine in this country is still very transactional. Right. You come to me, your insurance or you pays me, I do this to you, off you go on your way. And we didn't feel like we were being very effective in that.
Very interesting. Yeah. So at what you mentioned that, you worked in other organizations. So the realization to open your own practice, when did, was it a slow realization, or did was it an aha moment where like, why are we doing this? Why not start our own practice and do it our way?
Well, I think that ultimately it was like a slow type of process. But we had pursued opening a practice while we were in Arizona, and then it just didn't seem like the timing was right. I'm really hesitant to do the business side of it. But But yeah, I think we kind of just had a little bit of a make it or break it kind of moment, in a sense that if, at least for me specifically, I don't know about you, but I just felt like I love the field. I love the profession. I love what I do. I just am increasingly frustrated with this, with the structure, with the
Yeah.
format of
Yeah.
all of those things. And we just wanted to be able to be accountable to our patient versus a third party. And it's just not getting better, you know?
I think
Yeah.
there was a little bit of both.
Yeah.
So I think there was a little bit of try everything else first.
Yeah.
And so that's the journey part of it. Can we
Yeah.
work within the system? Well, what is the barrier there? Can we, okay, let's do it this way. And so we sort of met those barriers. And so I think that guided us. But then I think also there was a sort of an epiphany moment too, where we said, if we don't do this our way, we don't want to do this at all.
Yeah.
And that was the final straw. That's where we said, we either do it our way or we don't do it.
We do something else.
Do something
Yeah.
else. Yes.
How long ago was that? How long have you owned the practice now?
We just finished our 4th year, so we're entering our 5th
Congratulations.
now. Yeah.
Yeah. Although the entity and the thought of it has been around for about 10 years.
Yeah, we've been thinking about
But
it for a while.
we were still sort of feeling our way, and lots of things happened, including COVID.
Yeah.
So there were lots of detours.
Yeah.
And now we have a practice that is pretty much what our vision was.
Very nice. Very nice. So you both are in the same profession and you work in the business together. How do you balance between your professional and personal life, being in the same space 24/7?
Well, I think it's helpful we have kids. I mean, having to juggle the kids along with it, you can't always live and breathe your business that much. So I think that's helpful. Jeff is a runner, so he does a lot of that. My family is close by. That's part of the reason we decided to be here. We tend to get together almost every Sunday. So family's important. And I think that helps.
I think that we have common philosophies. We don't have necessarily common interests all the way around, but Tracy and our approaches to different aspects of life are simpatico.
Nice.
So how we raise a family, and that also really drove this too, because we wanted to be able to run our own lives and do things the way we wanted it to be, and also have the time. You mentioned that we run a business, and it is all time consuming, of course, but it is our time, and we get to dictate when we're one place or when we're doing something. And yes, it never stops, but at least we get to guide it. No one else is guiding that for us. And so I think that makes things smooth at work, smooth at home. Not always, but overall, we're in control of that. And that's very helpful. Balance in life, really.
Yeah. And that's what simpatico means too, right? The harmony. So how does the name reflect your approach to patient care?
So I think this brings us back to sort of the teaching model and our frustration with the system that we were in before. It was it's a transactional system where you end up seeing a lot of people. It's very busy. Get them in the door, get them out the door based on reimbursement. And, they try to make it fun. We worked for people that, you're doing your best.
Yeah.
Ultimately, you have to see more people. Again, it's very reactive medicine, where someone comes to you when they have pain, you put a patch on them and out the door they go. But what we realized was that we weren't very effective. in that model. Overall, we could be more effective. Not only were we not effective for our clients because they kept coming back to see you for the same thing over and over again, so obviously there's not a good learning curve going on. But also burnout among clinicians. You know, you're working, you're seeing multiple people, and you just feel like, I'm not doing a great job teaching here. So this is what sort of brought us to our core philosophy, is that mindfulness is necessary for proper learning, for fundamental learning. And that requires attention.
Time.
Time and attention.
Yeah.
And so Simpatico came about just because it's a wonderful word. It's a word in Tagalog, Tracy's mother tongue, and Spanish and Latin roots, and it means agreeable or likable. How can we work this into your life? How can we be harmonious with your life? And so we just felt that that name captured our philosophy of teaching people properly the right way the first time, and teaching people to take care of themselves, and therefore being more effective.
Wow. So how do you integrate this and show patients the big picture, that it's not just about treating injury, it's also about making mindfulness a lifestyle itself?
Well, you know, a lot of it, we really try to see, you know, what is the barrier, you know, what is happening to this person's story that is making it so, you know, maybe they're not recovering well, or what set them up to be in the position that they're in terms of their function. You know, we talk a lot about the different pillars of health, you know, that we look at. So we're not just looking at, you know, okay, what did you come in here for body part wise, but what are all the factors that go into that? Is it, you know, like, are you not sleeping well? Is your lifestyle really setting you up so that you're not having the rest component, or is it the other way? You know, you're not doing enough. We really try to kind of figure out, like, how can we do the most concise, the most manageable type of intervention corrective plan, so that they can be successful. You know, we don't want to just throw all these exercises at someone. We want to see, we try to make it concise, make it manageable. They can do it. How do you integrate it? Are you the type of person that needs to have it structured, or are you more the type of person that can integrate it through your day? You know, we're two different philosophies, so it kind of helps to capture the population more, because, you know, Jeff loves to exercise, so for him it's very easy to get that in there. I am busy juggling things. I don't really like it. So I try to, what can I do when I'm doing things, or what can this person do as they're doing their day to kind of make themselves more, to integrate this, to integrate the movements, to integrate that. And that's where mindfulness is really important. We feel that so much of our lives now are just so like task-based, I guess. And so we're not really paying attention to ourselves until it screams at us to slow down, to do that. Because, but the thing is, so we get disconnected from all those signals that the body's saying, hey, you know what, either I'm getting tired, or I'm getting stiff, you need to change positions. So if we can just kind of bring that attention back, you know, we have a chance at preventing something before it turns into something big.
I think the big thing is attention to detail.
Yeah.
So we have as Tracy was saying, a more holistic approach that's educating our clients on not only the big picture, but what all the pieces of the puzzle are and how they interact with each other. You can't fix one thing and ignore 5 other components, because it won't all get fixed then. So we do more of that. We teach them how all of these things relate to each other.
Right.
And what's necessary to do that is time and an undistracted environment. because in order to learn fundamentals, you cannot be thinking about a lot of different things at one time. So that's where our practice, I think, is very unique, is that it's a very it's not a busy, distracted environment. You come in, it's one-on-one all the time. We're the only employees. So when you come in, you are getting 60 minutes with us. And we begin with that foundation of thorough evaluation, including what is that person's learning style. Because in order to teach someone, you have to listen and pay attention. And so, sometimes I don't get to know my patient until the second or third visit. And it's an epiphany at that point. I say, wow, I know how this person learns. And now I can make that connection and help them to understand what we're doing and why we're doing it. More importantly, because if you know why you're doing something, you're more likely to do it. If someone just tells you to do something because I said so, who's going to do that? But if someone says, here's what you're supposed to do, and this is why, and now you can start to see the results, then you're going to be invested in that.
Yeah, makes sense. So that's very interesting. You're not just teaching people about living mindfully, you're incorporating mindfulness as you're seeing your patients in paying attention to how they learn, what's their basic needs, what is their style, and you're incorporating mindfulness in the way you treat and you evaluate your patients. Very interesting. Can you elaborate more on how else are you being fully present in your clinic and being mindful about what your patient needs are?
So I think one of the things that we definitely share is that human movement, is based on a developmental sequence and built on fundamental movements, and that learning those foundational movements very, very well is very important. We learn it as children. And preferably in a non-distractible environment initially. If you watch children, babies grow and learn how to move, first of all, no one really teaches them. They are a product of their environment,
Right.
and the need to explore. But what they do is they have undistracted time spent doing these tasks over and over and over again and refining those tasks. And so when we do something what we call corrective exercise, because now we're no longer babies, and sometimes we're relearning these same fundamental movements that we did learn at one time and have somehow gotten away from them. And that requires performance and practice, correction, and then more and more and more repetition. And just spending the time doing and paying attention to the movement. So we direct people back so they can focus on those movements. And then through the repetition, they learn what we call motor learning, how to memorize movements. And then eventually when you learn something in an undistracted situation and you get really good at it, now you can take that movement into a more distractible situation. You can take it into busier environments, but because you've memorized the movement and you've perfected it and gotten better and better at it, you can do that. It becomes sort of an autopilot.
Yeah.
But that is required. What is required is you have to get those fundamentals down. And that's where our philosophy came in. We said, in these other distractible environments, these people aren't learning the fundamentals.
Yeah.
And so that's how we apply it in our practice.
Our practice allows people to really feel what they're doing. I think that when you're just telling somebody, okay, go do this, and you walk away, and it's somebody that has, really kind of disconnected from how they move, they're not really going to feel that control. It's
Yeah.
just going to be bypassed. And usually the body's mechanism with dealing with any type of weakness or any type of stiffness, any type of deficit, is to offload that movement or that job to a different body part. And so if you're not there and you're not taking the time to really think about how you're doing something, you're always going to go to that pattern, right?
Yeah.
So this whole motor learning requires time. It requires attention. It's like learning and it's funny because it's not really learning a new skill. It's relearning an old one. But,
Yeah.
it's always, you don't learn how to play an instrument by trying to do it fast, right?
I
You have
agree.
to take
Yeah.
attention,
Yeah.
you have to pay
Yeah.
attention to all these different things. But then once you've done it, then it can be something more spontaneous and you don't
It
have
gets put all together.
right, exactly. But we're really focused on that beginning part.
And a lot of that some people call it, I think, teach back methodology. I mean, I'm not sure I 100% agree with that term or the definition of that, but we do a lot of that. We do a lot of tell me what you feel.
Mhm.
Tell me what you're feeling here. Tell me what you think you did correctly or incorrectly. And that sort of that feedback loop is really part of that mindfulness, because that's how you know they're getting it. They not only can they perform it, but sometimes they can verbalize it or verbalize what they're not, the imperfections. And one of the things we teach is that, there is no perfection. Actually, when it comes to movement, it's a journey. As practicing mindfulness is. If you think about it, you're not reaching nirvana, but you're always going to be working towards getting there, right? So you're applying those things and reapplying, and that journey and that feedback loop that we get, and that helps us to guide them. And that's how we know when they're getting better, when they almost become the teacher.
Right.
Very interesting. Very interesting. I'm trying to, I feel like I'm drawing some parallels with what we do in our audiology world, where when we put hearing aids on somebody, we're like, okay, don't go directly into a noisy restaurant now that you have hearing aids. Start slow, start with at least the first week of just being in your everyday home situation, get used to your routine sounds, and then go put yourself in loud, noisy situations. So you're kind of, bringing the same awareness as you're doing it with your patients, and just help making them be more mindful about how they're moving and taking it at that speed. Very nice. Very interesting.
Yeah, and that's exactly right. Like you would teach someone, they need to learn to use the hearing aids and learn to use them properly in a low distraction environment first, before you go into a higher distraction, more excitable environment.
Right.
And movement is the same. In fact, everything we learn is the same way. I mean, like Tracy said, the example of playing an instrument, you spend hours and hours and hours sitting in a room by yourself doing little pieces and little components over and over and over again. And then you blend a couple components together, and then blend a couple more components together.
Yeah.
And that's what learning is all about. And it applies to movement just as it does to any other kind of learning.
And those foundations are key. I mean, it's really something you can't bypass.
I agree.
I mean, you can try, but I think that's where it keeps happening, right? That's why the whatever they're here for, sometimes it's repetitive, right? It keeps happening because there's not that foundation in the very beginning.
Yeah, yeah. So you guys are healthcare providers and small business owners. How does being local impact the way you practice?
Well, we have always said that we wanted to work where we live. I think for us, it's important to be integrated with the community. Our kids go to school here. We also, Jeff runs to work sometimes. We want to help the community. I think public health is something that's very important. really, we're trying to keep people healthy before they get hurt. Also in the senior community, we're talking about doing fall screening assessments, that kind of thing. I think the village is important.
Absolutely, absolutely. So, in what ways are you reaching out to the community? Do you do a lot of events, workshops? Are you doing partnerships with other local businesses? What do you do to reach out?
A little bit of all of that.
Yeah.
I think one of the things that is difficult for us, but also is helpful, it makes for slow growth, because our in order to stay true to our philosophy of our business, it's about relationships, and it really is about relationships, not just the buzzword. So that is time consuming. That means, yes, we do workshops, but we keep them small, and we rely a lot on word of mouth, and that makes for slow growth, because we want someone to feel the quality of what we're doing and tell someone else and tell someone else, versus just kind of media blasts. Because a lot of, once, in this world, once people get a hold of something that's successful, they will use that phrase or that word or that quote philosophy, no matter what. And so it's easy to say you're mindful, and it's easy to say that you're a one-on-one personal practice. Anybody can say that. And you can blast that out there. But what we want is, Joe to tell Martha, to tell Susan, to tell, and that's slow growth, but it's relationship based. I mean, these people know us, and even the people that get referred to us by someone else often tell us, I feel like I know you already because of what I've heard from someone else. And
Very interesting.
it's a hard way to run a business, but you know what? That's the only way we're going to do it, because we are business people, but we truly are health practitioners and functional medicine practitioners first, because we care about people, and we're not gonna do anything that's going to divorce us from that philosophy.
Yeah, and there's only two of us,
Yeah.
and we have a lot of plans, ideas, things that we would like to do.
Yeah.
But it's a little bit slow going. I think we've been talking about a YouTube channel for a really long time. It is in our to-do list. We would like to do more like monthly, either just wellness type of videos and things that we are I think our brainstorm list is very long, but trying to get that to fruition, it's taking time. But that's kind of one of the things that we are trying to get up and running is are different helpful hints. I do have something on our site about a movement of the month, trying to get people to be more aware of, hey, these are things that you'd like to kind of start checking yourself now when you're in your 20s, 30s, 40s. Keep this movement so that you don't have to have some problems down the line. A lot of that public outreach, I would like to do more of. We would like to do more of. It's just time.
Yeah. So talking about the movement of the month, for the listeners who might be at their desk right now, what's one simple movement or posture awareness tip that would be very helpful for them?
Let's see if we agree on this.
Oh, okay. You want me to go first?
Yeah.
So I think in terms of really simple, really easy, I think just stand with your back against the wall. Can the back of your head touch at the same time as between your shoulder blades, as your low back and your hips? I think that especially if you spend a lot of time at a desk, some people start to lose this type of extension.
Right.
And sometimes it's too late. It's never too late. But sometimes all of these restrictions have started to occur without us knowing it.
Yeah.
So I think that's one of the things that I end up having to really try to regain for people. And I am such a big, big supporter of preserve your motion, preserve your movement rather than having to regain it. It's so much easier.
Makes sense. Makes sense.
What's yours?
Well, for me, even though it's built with a lot of different components, it's sort of, to me, the culmination of human movement. So we both use this in our evaluation, but I think the fundamental culmination of basic human movements is the squat,
That was my
is the
second.
ability to squat. And you should never lose this. And they've shown across societies that it's not age dependent. And so, but in the industrialized world, we lose this ability. And so for us, we not only do we use that as one of our evaluative tools, because there's so many components that we can see in that basic movement, but we also use it as a fundamental teaching movement that you need to learn to squat again. And, people they can't do it properly. And so that's a lot of times, if I only give somebody one exercise initially, now it's going to be a supported one, it's going to be a very guided one, but teaching them to squat again.
Very interesting. Very interesting. So, for listeners who are new to the whole mindfulness movement, how different is it from, when we think about workouts, the big sweaty workouts to be healthy and to be fit? And, you're turning the tables and you're encouraging more about being mindful about their movements and all of that. So for somebody who's new to this, how would you tell them what's the difference between the two?
Well, so I think a lot of it is more think control over number in terms of your movement. There are a lot of times that I don't like to use repetitions as a exercise prescription. I give people more time based because to me, the repetitions don't matter if they're not in control.
Yeah.
So it's really working on that attention to the quality of what you are doing versus the number, because all you do in terms of your workouts and your gains when you're doing something without thought, without control, is teaching your body to move out of control. Where if your movement is purposeful, it is controlled regardless of speed, then you're going to prevent injury, number one, because your body you're giving your body a chance to say, hey, this is not a range or a movement that I'm comfortable in. Approach with caution. And then also you're learning your body awareness. You're adding that proprioceptive feedback when you're doing your motion.
So yes, quality over quantity. Mm-hmm. Although don't get us wrong. Yeah. All exercise is good. Mm-hmm. I mean, in fact, in a nutshell, just get out there and do something, or as Nike says, just do it. But if you pay it, just like learning to play the piano, right? I mean, any type of playing music gives you pleasure and it's fun and it's good for you, but you can practice the fundamentals and learn them, and it's going to reward you in the long run. So we tell people consistency over intensity, and slow down and learn the movement patterns, and you'll be thankful in the long run, because not only will you be more efficient and more effective when you do finally do the sort of whole program, but you'll prevent injury, as she said. You reduce the setbacks. Or not everyone's going to have a setback, but plenty of people do, and that's why we're in business. Mm-hmm. So you can reduce that by emphasizing those fundamentals.
Sounds good. Okay. So I want to ask you about your relationship. You guys are married, you run a business together, you raise a family together. What personal mindfulness practice do you practice to keep you grounded through all of this?
Well,
You said Jeffrey, you run.
He runs, yeah.
And she's very respectful, and she's very respectful of that process. I mean, she understands that I need that, and so even though she doesn't get it, that's
No,
okay.
I don't understand running at
She
all.
doesn't understand it, but she does see and feel what I get out of it, and that is, it allows me that calming, it allows me that mindfulness, it allows me to be focused and consequently nicer. And so she gets that. And so I think even though our applications of mindfulness are very different, we are respectful of each other's. And so, where Tracy gets things, she's a busy bee. She's the master of NEAT, which is non-exercise activity thermogenesis. So she will fold clothes and do something else, but it's not in a scattered way. This is kind of where she learns her sort of hyper focus, and allows her to be mindful.
Yeah.
And she needs that time. And so I give her that time. I understand when when that's her time, that's her. She needs that to sort of become mindful and focused and pull everything together. Then you go do that. And she does the same, has the same respect for me. And we have our common times. I think mornings are very much common times. I might be a little more garrulous and like to talk, but I understand that Tracy doesn't.
Right.
And so we can sit there in our nice room with our coffee or tea or whatever and just be. And a lot of, and sometimes dialogue will go on, but we're just respectful of the time that this is our time to sort of bring it all together before we go out and face the world.
Yeah, yeah. So what is the most relaxing part of your day?
I think it's really at the end, like we have a dog and our dog is just fantastic. So it's really the interaction. It's funny, we have kids too, but they're kind of in their teens, so they have their own lives. But now it's more, at the end of the day, maybe after dinner with our dog, and we're just kind of relaxing then. I think that's the main thing, because Jeff sleeps early and I'm a night person. So I think that's actually where we have, where everything has kind of, the dust has settled for the day, and then we can kind of figure out the next day a little bit. But I think that's a relaxation time for the most part, and Friday night especially.
And
Yeah.
then mornings too. I think we have, a little bit at either end of the day when we can do it. I mean, we match up in that we're both present, but
Yeah.
her in the evening, she's more present than I am because my brain shuts down. And in the morning, I'm more present than she is because her brain hasn't gotten started up yet. And that's okay. I mean, we understand that about each other. We
Yeah.
both need those times, but we process them differently.
Right.
Also, over the course of the business, like now that we're a little bit more settled in it, I think we still have growth to do, but we are more settled. We have just been purposefully trying to schedule specific times in the week where we can not necessarily do patient care, but kind of get on the same page from the business standpoint too, so that we're not just, hustling here and there. We have a moment to just kind of reflect and say, okay, where is this going? What do we want to do? And so, and like everybody, we get out of sync sometimes, like things happen, schedules change. But we do try to make sure that we get back to that. And I think ever since we've started doing more of that, I feel like our vision of this business is really, really coming together.
Yeah.
I think our first couple of years were treading water, trying to figure out where we needed.
Yeah, we were still defining ourselves.
Yeah, we were still defining ourselves 100%. I think now that we're here, and we've started doing those times, I think we've got a clearer vision and we're really more united in terms of what we see this practice going.
But you're
Yeah.
right. When we schedule time,
Mhm.
not necessarily with a to-do list, though we do have to-do lists, but when we schedule that time, it's sort of like that time can be used for anything. And
Right.
sometimes we're actually exercising because we do all of the exercises that we give people, and it's an evolving thing. We are not learned, we're learning
All the time.
all the time.
Right.
And so we practice ourselves, and anything we do with people, we're practicing and problem solving, and we put our brains together, and Tracy can see things that I can't see. And so I can sometimes see things that she can't see. And so that's our time just to kind of free form it. And so without having any kind of strict definition, it's very helpful for the creative process.
Very interesting. You guys really take the simpatico or the mindfulness philosophy through and through to both personal and professional life. Very interesting.
We hope to.
Yeah.
Very
Yeah.
nice.
Yes.
Do you guys have a book or a podcast that you would recommend about mindful living for our viewers?
I don't have a podcast that, I do like podcasts,
Yeah.
but the times that I've got too many podcasts to look at. So then I'm sort of scattered, but I read a lot.
Yeah.
So I think she does a lot more of watching, and, but I read a whole ton. And I know a book that has affected both of us
Right.
recently was, not so recently, but it's Breathe, by James Nestor.
It's in
And
a bookshelf somewhere there.
yeah, so it's and it was, it really opened my mind up to the art of breathing,
Yeah.
because breathing is truly, when you get down to it, it is the most fundamental part of even mindfulness,
Yeah.
but certainly of living, and
Yeah.
certainly of function and doing. And so it just brought it brought direction to something you think of as such a simple thing, or you don't think of
You
it
don't think
at
about
all.
it at all, really, until you're.
So it was very eye-opening for both of us, how just the art of breathing can be incorporated into your life, and how you can incorporate it into function and exercise and all of these things. Sleep even.
Yeah.
And just many different applications. And
Yeah.
it talks about specifically the mindfulness of breathing.
Very interesting. I got to check it out. Thank you.
Mhm.
Thank you. Well, I think that's all the questions I had. It's a very interesting conversation. Thank you again for taking the time to, talk to me. Like I said, I think when I talked to you over the phone, to me, mindfulness is very new, yet it's something that I've grown up with coming from India. We've taught from a young age to meditate, to do certain things, but to really deep dive into why you're doing all of this and how it affects your everyday productivity, and especially since COVID, things have changed drastically, and it's very important to just be in the present, to say, okay, it's okay and it'll be okay. So mindfulness has become a very integral part of my life.
Us too.
Us too. Yeah. It definitely wasn't anything that I consciously thought about before. But I do think that having to manage so many different things, being busy, I've found that a little bit goes a long way.
Yeah.
I think that slowing down, it's counterintuitive, thinking that if you slow down, you'd get less done. But ultimately, it actually refocuses you. And then in the long run,
Yeah.
you're actually more productive. You're not expending all this extra energy doing unnecessary things.
And
I agree.
mindfulness is not clearly defined.
No, it's different for everybody.
You think about it, it's a little different for everybody. If you ask 10 different people, you probably would get 10 variations in definition. And so I think that's sort of cool, actually, because mindfulness is is something that's evolving, so to speak, or your application of it. Each of our applications of it are evolving, and that's kind of neat. You don't know exactly what it's going to be, but you're just continually practicing it.
Yeah. Yeah. Very interesting. Yes. Yes. Thank you again. Thank you for your time. I'm really
Thank you.
excited
Yeah.
to.
Yeah.
Yeah, this has been a good, wonderful conversation. A lot of learning. Yeah, so much similarities. I've had friends back home who are physical therapists, but I've never seen anybody kind of take this approach into what they do. And like you said, it's just the system has gone down so much where you're so reactive. And in our practice too, we're trying to kind of slowly work our way out of being reactive and just be focused on what the patients truly need.
Right.
Right.
Yeah.
Yeah.
Yep.
Yeah.
Change the
Thank
system
you.
one person at a time.
This was fun.
Yeah, very much so.
Very fun.
Thank you very much.
Thank you. You have a good afternoon. Tracy, Jefferson, thank you both for joining me today and for sharing not just your professional expertise, but your personal wisdom and heart. For those who are listening, if you want to learn more about Simpatico Physical Therapy, visit simpaticopt.com or stop by their Sterling location. I'll link everything here in the show notes. What I love about your work is it's not just about physical healing, it's about connection, compassion, and presence. You remind us that mindful movement is more than exercise, it's a way of living. And to our listeners, may you take today's conversation as an invitation to slow down, listen to your body, and lead with intention. Until next time, stay present, stay inspired, and keep making a mindful impact. Thank you.